Through the Great Depression, World War II, the second half of the 20th century, and today, the Arkansas Hospital Association has been supporting better health in our state. Since it was founded in 1929, AHA has acted as the eyes, ears, and voice of Arkansas hospitals, making a significant impact on our health care quality and status. Key accomplishments include helping to get the $1.6 billion tobacco settlement fund earmarked for health-related purposes, implementing a new law that made all hospital campuses smoke-free, coordinating statewide relief efforts for displaced hurricane victims, providing a program to enhance Medicaid reimbursement, and legislation to implement a statewide trauma system. Today, AHA is setting the course for more accomplishments and advancements that help ensure a healthier future for all of us. Through our 80-year history, we have had only 4 chief executive officers. The first was Graham Nixon, the second was Roger Busfield, the third was Jim Teeter, and the fourth was me. So during this time, we had a great continuity, and you're going to have continuity with Bo Ryle, even as he enters his era. But that is one thing that I think our members have helped us do, as well as our board, is to stay the course, have good people, and we're very proud of the fact that we've only had 4 CEOs, you might say, in the history of this organization.
When I look back on the history, at least during my time, the history with the association, I've always had great respect for the leadership that we had, the top person and the team that person put together to make a strong leadership group for the association. That's the most important thing that association can have, great leadership, and we've really enjoyed that in Arkansas.
The Arkansas Hospital Association was a critical backbone in early efforts to improve the health of our state. 10 years ago, with the Tobacco Settlement Act, we actually became the only state to put all of our tobacco funds for new health programs. And the Hospital Association was critical as we went around to the cities to host the team that was advocating for those funds. 10 years later, we're now a state that can show a 45% reduction in youth smoking and a 20% reduction in adult smoking, singularly because of the efforts of the Hospital Association and the members of the Coalition for a Healthy Arkansas Today.
Arkansas is one of the few states, if not the only state, that was able to allocate all of our tobacco settlement funds for health and health-related purposes. We're very proud of that.
Over the past 15 years, Arkansas has reduced the proportion of our uninsured kids from 20%, 1 in 5, now to less than 7%. The funding for that was instrumental, and the Hospital Association helped lead the charge in funding it with a soda pop tax, which has been a long-term and stable source of revenue for the Medicaid program.
I think one of the important initiatives that the Arkansas Hospital Association has undertaken has been the statewide trauma system. That legislation passed in 2009. And I think what we're seeing is hospitals begin to develop and become trauma centers. Very important for Arkansas because we lead the nation in highway fatalities. We've seen that number decrease already, and as we move to the future, we're going to see more hospitals become involved, more lives saved, and we're going to have a bright future for the state of Arkansas.
Looking forward, we've got some opportunities to actually eliminate the financial barriers to coverage through the healthcare reform effort. But importantly, we're going to have the leadership that the Arkansas Hospital Association has demonstrated in the last 80 years looking forward so that we can make our communities the places that our families want to raise their children, businesses want to expand and relocate, and to let Arkansas become the diamond that it can be for the nation in leading the way.
An important topic today is the Health Information Exchange. And the Arkansas Hospital Association has played a key and vital role in the development and soon-to-be implementation of the Health Information Exchange. One of the exciting features of the exchange is it's going to really eliminate some of the barriers that have existed before between hospitals and sharing information. We're going to be able to use technology and move patient-centric information from one hospital to another in a secure environment and really stay centric to our goal of a better patient experience, improved quality of care, and gained efficiencies.
The Arkansas Hospital Association leads the way in quality, and working and networking with the Arkansas Foundation for Medical Care, also Medicaid, they were able to have a program that provided incentives to hospitals who met certain quality thresholds, and to be incentivized and have that availability to us is not only helpful to the hospitals, but it's good for the patient.
One of the things the association does is drive information out to the association members, all the providers, all the hospitals in the state. They're very effective at that, and we depend on them to get the information first, and when they do, they have the ability then to convey that to us through various mechanisms, including their website, which has really become important. They are quick in their dissemination of information, and they also solicit response to the information they put out because they need to know what the members are thinking. And so it's a two-way street, and they do it well.
The Arkansas Hospital Association works very closely with the National American Hospital Association on a variety of both short and long-term strategies to assist in remaining viable as healthcare givers and providers. Arkansas is very well represented on that policy board, which provides feedback to the American Hospital Association on issues that affect this region. So that's a very important part of the work of the association.
The Arkansas Hospital Association allows us the opportunity to network and to learn from each other. And every meeting that I have ever attended, not only do you get benefit for the program that you attend, but the ability to network with healthcare providers who are facing the same challenges that we are, and to learn from each other is always something that is helpful and beneficial. Also to know that through the Arkansas Hospital Association, they unify our voice. So me being a small rural facility in Northwest Arkansas, facing the same challenges as someone in an urban area, we can combine our voice and make changes that are positive to the health care that we can all provide to the state of Arkansas.
The rules and regulations are coming, and the devil is in the details. It'll be over the next 10 years that the details will come out on healthcare reform and its true effect on hospitals. And I think it's very important for our association to have good relationships with our congressional delegation. We're going to have at least 3 new congressmen in Washington. So it will be up to us to have that kind of relationship and to shape the regulations so that they are favorable to hospitals.
You know, the public is going to play an important role in healthcare reform, is going to play an important role in how we utilize technology. The advent of the smartphone is giving people access to information they've never had before. But likewise, we're able to take these devices and put them in the hands of physicians, put them in the hands of nurses, and put them in the hands of clinicians that work in our environment and utilize this technology in a very mobile environment, in a very meaningful environment, and exchange information so they have it at their hand, at their fingertips, at the time they need to care for that patient, at the time they need to make that decision, at the time that it's most important.
I'm very confident in the staff of the Arkansas Hospital Association. They're very tenured, they're very experienced, and they are our voice, and we appreciate what they do for us and appreciate the advocacy that they provide to each hospital in the state of Arkansas.
The AHA is no stronger than its membership as a whole. It is absolutely essential that every member hospital be involved and take part in AHA activities, have their say-so about what's going on in the business, because we need every hospital to remain strong.
We've learned over the years that hospitals and healthcare institutions are not just to take care of the sick and the ill, the infirm and the injured. We're also there to improve the health of our communities. None of us are immune. None of the providers in the state are immune to that. We all have to be more sensitive to the needs of our community and how we can improve their health. That's going to be very important in the future.
On behalf of the state, I want to thank the member hospitals, the Arkansas Hospital Association, for providing the leadership that they do in communities across the state. We have to have a strong hospital system if we're going to have a strong healthcare system. And the last 80 years demonstrate the leadership of the Hospital Association. In the next few years, that leadership is going to be more critically important than ever before.
I'm really optimistic about the future of the Arkansas Hospital Association. We've got a great membership, we've got a great staff, we've got an outstanding organization, and I think as we move into healthcare reform, we have a real opportunity here to shape healthcare in Arkansas and provide for a better future for Arkansas hospitals.